United States, there is a great need for medical services as many Americans face health-related challenges without adequate access to health care. People experiencing homelessness, the working poor, migrant farm workers, elderly who have lost the ability to take care of themselves, all are in need of access to health care. For many, free medical screening camps may be the only option for much needed access to healthcare services that may even save lives. According to Dr. Joe Fanoff, chair of the U.S. Medical Committee, Sri Sathya Sai International Organization USA, there are 5 areas of needs that should be addressed in the free medical services we provide. 1. Ongoing free medical care throughout the year. 2. Mental health services, especially during these challenging times. 3. Dental services, since dental health is vital to overall physical health. 4. Vision screening, including providing free eye care and free prescription glasses through collaborating with local organizations like the Lions Club. And 5. Holistic preventative health education with a focus on healthy food choices, daily exercise, and stress reduction techniques. Let's hear from 2 patients at the Oxnard Medical Camp.
Doctors for nutrition, vision, pap, and the blood for my high pressure. It's good the work for this group, the medicals. It's my new glasses. I'm very happy.
This is a lovely thing that this organization through the Catholic Charity, and I personally has been experienced that I lost my insurance like 3 years ago, and it's hard to me to afford all these lovely services that I went through, and I really appreciate it from the deep of my heart because I feel comfortable and very happy. What cost me was a lot. Only one smile, they already paid off everything.
Ideal Sai Healthcare can be summarized in Satya Sai Baba's advice to doctors. Even more than the drugs that the doctors prescribe, the sweet, soft words they speak and the sympathy they evince can cure better and quicker the illness of their patients. Look upon them as your own kith and kin, as your special guest, and as your closest friend, and attend them lovingly with unflinching care. I call upon you to maintain this attitude in every situation. Satya Sai Baba. Let's hear doctors reflect on what it is like to serve patients the ideal Sai way.
When I go to the medical camps and I get to do his work, there's something that I feel that is priceless. I feel him through me. I feel him doing the work. It's not about giving myself accolades at all. It's that closeness that I can get with him.
It's really important to remind ourselves that when we have a pure desire to help others with no expectations, the universe will conspire to help us and manifest these noble desires. So we should think big because anything is possible. When God is helping us, we don't have to worry about the end result because we can just leave the results in His divine hands.
Thank you, everybody who came to this session. Thank you, Swami, for bringing all of us together. We have a beautiful panel discussion here. We are a little late, but I'll keep the introduction very brief to our panelists. I'm Vijay Krishnamurthy. I'm the Region 1 Service Coordinator, and I'm a cardiologist by profession. And I enjoy working in Swami's Hospital, apart from all the medical camps here. And all of you saw Dr. Joe Fanoff. He's a practicing dermatologist in Northern California. He's the director of the Ashland Free Clinic in San Lorenzo, California. He is the chairman of the Medical Council for SSSIO-USA, as you saw in the video. And he's also just stepped down after being the National Young Adult Advisor for a long time. It was fun to work with him, and it's very inspirational. And he has inspired several projects in the medical field here. It's great to have him with us. And we have Dr. Ramadevi. Shankaran. She's a pediatrician practicing in Indiana. She participated in several camps and organized several camps nationally and internationally, like Haiti, Philippines, Ecuador, Kazakhstan, Jamaica, and India. So a wonderful person with a lot of experience in our panel. And Dr. Kannumuri, he's an emergency room physician and practiced in the St. Louis area. Again, for over 3 decades, has helped organize and participated in several medical camps. Currently, he is trying to organize a free medical clinic. And he's here to share with us some of the pleasures and pains of trying to go through this process of starting a free clinic. And we have Brother Mani Mistry. Mani saw Swami in 1967 in East Africa. He was born in Kenya and had first darshan of Swami in the airport in East Africa. So from that time onwards, his Sai Seva took off, I should say. And he went on this journey to study computer science in the Brunel University in London, and served as a center president for Dallas and service coordinator for Region 10. And in this process has experience with organizing several medical camps around the Eastern Texas area. A wonderful person to have with us to learn about medical camps. And also I have to thank Sister Anita Shankar, who came into Swami's ways at a very tender age of 15. Her family was one of the first devotees in Singapore, and has her only passion is Swami and serving Swami. And she's the USA national team editor for the media team. And she is the one who put all of us together in this beautiful camp. So with that, I would move on to our panelists. First, I would like to start with Brother Mani. Brother Mani, let us know what are the main ingredients. How do you go about, somebody in this group now says, I want to do a medical camp, and what are the main ingredients they should look for before, when they set out this journey?
Salam, everyone. Thank you for having us, and thank you for joining us today. Before we start, I just wanted to share a little brief story on why we started doing this. In 2003, our region, at almost 350 people, ended up having a pilgrimage to India to visit with Swami. While we were there, we were doing all kinds of services, and we had to ask Swami, what can we do to serve you? And Swami says, it's very simple. He says, go and serve your community. So after we've had our darshan and we had our play and everything else, we go and sit down and we talk about it. And then everybody in the group said, we need to make something, we need to do something which is more dynamic and is a greater impact than what we do now. So when we came back, we started looking around our region. Now our region comprises of Arkansas, Oklahoma, and Texas. Of course, Texas is the largest. So we started looking around in Texas, what can we do? And we found a small place called Kennedy in South Texas, which had a tremendous need of medical help, because a lot of the population which lived there was coming over from the border and they needed a lot of help. And of course, we were put in touch with the mayor of that city by one of our devotees who's worked there with the mayor and his team. And when we talked to the mayor, he was excited that we are going to do something for his community. So we identified that there is a tremendous need. So that's the first point we want to discuss. Anytime you do a camp, identify the need which is required in the community. Now, after we've done that, the next thing to do is to basically work with the community itself. So what we started doing was we started working with the mayor. So when we work with the mayor, the police department comes in, the fire department comes in, other charitable organizations who work in that city comes into play as well. So with all their help, we have to build a team now. So at least we've got the building blocks. As the first building block was to work with the mayor. Second building block is to identify the team. When we identify the team, we identify infrastructure team, we identify the doctors, we identify the nurses, and so on. So once we've identified all that within the community, we get involved working with the community a lot more. At that point, what we do is we get commitments from all the different organizations we work with. Once we've got the commitments, we've got the infrastructure. Now what we need to do, number 3, is to build the infrastructure. And that's where what happens is we get the support from the local community to build the infrastructure. In this case, we did not, so we had to work with our devotees who built the camp for us. So whenever we want to build a camp, we have to have all the little rooms where you can have your consultation rooms, medical rooms, nurses can sit and draw the blood and everything else. So we had to do that. Now, once we did that, in the future years, we worked with East Texas. And when we talk about working with the community, when we worked with them, they ended up involving the local community. Basically, the people who were incarcerated, they were let out for a day to serve. So they were building our infrastructure. So it's amazing when we get everyone together, how much progress we can make. Once we've done all that, we figure out a date, we've got our doctors all sorted out. The most important thing which we have to do next is to promote the camp. And that's where, in those days when we started the camp, there was not too much social media. So what we had to do was to have a flyer and everything printed, and we instructed some of the local city members to put those flyers in their utility bills. So at least people are aware that the camp is going to happen. Nowadays, we are very fortunate. We can put everything on the website and everybody looks at it and we can get the camp going. So promotion is the most important thing which we have to do. Once we've built our basic building blocks has been done, next thing is to promote the camp. Once we've promoted the camp, and then after that, we wait for Swami to come. So it's very simple. When we open the camp, just like how brother says, treat everybody as a guest of honor when they come to serve. So we are treating each and every person who comes to the camp as our guest of honor, and we serve them with lots and lots of love and compassion. I hope this helps, brother. Thank you.
Thank you so much. I think these are great ideas and great ways to start. Find the need and find a location where you want to do the camp, and then find physicians and nurses. So you got the ingredients, and you have the blessings of the mayor or somebody within the community who's a leader. And then after that, you find the location and set it up and wait for Swami to come. Beautiful, beautiful. And I am going to share a medical camp organized by Dr. Rama Devi.
Sairam, we did medical camp in Des Moines, Iowa, which is part of Region 5. It was conducted on September 24th, 2022. This was the 9th year this medical camp was conducted. We collaborate with the public health, which is a Polk County. We also collaborate with Every Step, which is also part of the government program. What they typically do is they offer flu shots, they do blood tests like blood glucose, cholesterol. We also get some interpreter services from the public health, and also the local hospital, Unity Point, they also helped us with the interpreter services as well. We do have different specialties like internal medicine, family medicine, pediatrics, ophthalmology or optometrist, dentist, endocrinology, and orthopedics. We used to give out reading glasses as well as sunglasses during the medical camps. Typically, we usually have around 40 to 50 general volunteers apart from the providers. Coming to the aspect of the visitors, as soon as the visitors they come in, they'll be fasting, so they'll get their blood test done. We'll provide them with some snacks, and then the volunteers will guide them to different specialties. Once everything is done, there will be a checkout process, and also they will visit with the visiting nurse service staff who will be arranging for follow-up cares with the local free clinics and also help them with providing with the medical insurance information. Most of our visitor population, they are from the local homeless shelters. They're also from refugee camps. So as they were going out, they'll be given a sack lunch. Most of the time we hear that they felt the love and they wanted to come back. So that's the most common comment we usually get from the visitors as well as from the volunteers. Especially the church volunteers, as they also come and work with us. And as always, Swami says, serve man until you see God in every man. And this is a wonderful opportunity to connect with the community and also collaborate with the other organization. So love is expansion. So we keep expanding. So now you can hear the feedback from the volunteers who participated in the medical camp. Thank you. Jai Sai Ram.
Dr. Amali, what kind of services do you think is ideal for these type of medical camps which you organize about once, any time between 1 to 3 or 4 times a year? It'll be good to hear from you. That was in a wonderful medical camp you had organized just recently.
Thank you, brother. My humble pranams, the dearest Mother Sai, and humble pranams to all of you. Thank you so much for this opportunity. I feel for the medical camp, so the major causes of death can be preventable usually. It's the diet, high blood pressure, diabetes, and the dental care. All these things are preventable causes of death. So sometimes we think, okay, we are doing a medical camp for half a day. What are we achieving? Is it even necessary to do that? But it's absolutely necessary because WHO says the health is like physical, mental, and social well-being. It helps not only the physical and mental, the social well-being because we are part of the community. So we feel the love, we spread the love. So that's major, it's beneficial mutually for the volunteers as well as for the recipients. So that's why we have all the different specialties in the medical camp and we collaborate with the local public health and the local hospitals. Now the whole community knows the RSI organization and they just feel the love. That's what basically it is. We give flu shots as well. So infection prevention, that's also mostly education, nutrition. We have nutritionists come and talk about the nutrition, hemoglobin A1C. It's a lot of different things. And we talk about hygiene. All those things will be available in our camp. Yeah. And one more point I wanted to reiterate is when you come to the medical camp, how it is different from other services. The other services for a soup kitchen, you can just walk in, right? But with the medical camp, it needs a lot of preparatory work because we wanted to be very professional. We wanted to gain the trust of the visitors who come in. We don't call them as patients because we don't want them to become patients. So our thought, word, and deed should be the same. So we call them visitors. So when they come in, we want them to have that full experience of the love and the trust because most of the refugees, they're scared to go to the hospitals. We wanted to make hey, they are all very safe people. I can trust them. I can go back. So that's the one thing. So all the volunteers will be trained in HIPAA and OSHA regulations so that everyone is safe. I just wanted to reiterate that point. Thank you. Sign off.
Thank you so much. Yeah, I think this is a great message. These one-time type of medical camps, which is not a continuing clinic, focus on preventive care, and probably you do a lot more than daily prescription of medication. So we don't realize these non-communicable diseases, NCDR. I mean, focusing on the non-communicable diseases reduces mortality in the community way more than that. So this is this is a beautiful model where you just take your blood pressure cuff, a blood glucose machine, and a cholesterol machine from a finger stick, and you're a one-man army, right? You can go anywhere in the world and stomp out some diseases with your advice, and that is amazing. Yes, we don't call them patients, and there is a beautiful story Brother Manny has to share. Brother Manny, would you like to share the story of the patient? Or again, making the mistake of saying the patient. You had a beautiful story about the lady who didn't want to come to the camp. Yes, this would be a good time to share that, I think. Yeah.
Sure. This is a wonderful story. Again, just want to let you know that we've been doing camps here since 2004 and 5. So we've been continuing for several years. So we get to see a lot of folks. And this time around, this one particular lady, she came to the camp the last time we had it in Woodville. It's a very small country town, very small area. And we had a wonderful camp there. It was called Woodville, Texas. And when we went there, there were a lot of folks. In fact, there was a big camp. We had a lot of people coming in and out. And this lady, elderly lady, not very old, but fairly elderly. She came in a wheelchair, and she was sitting there, and all her, the people who were with her, like her daughter, sons, and the husband, they were encouraging her to go to the camp. And she says, I'm not going to go to the camp. And I saw a little commotion there. So I just kind of casually walked over, because my job at the camp is being an usher. So I just casually walked over and said, can I help you? And she says, I don't want to go to the camp because I hate doctors. And I said, why do you hate doctors? She says, the reason I hate doctors is very simple. All they tell me is I'm sick. They never tell me I'm well. All they tell me is I'm sick. So I said, no, our doctors are different. They don't do that. So luckily, we went through the whole camp. And each and every doctor she saw, she had a few ailments, so she saw a few doctors. We had the cardiologist, just like our sister mentioned, we have a group of doctors there, and they all visited with her. And every doctor she went to see, she spent a good amount of time, valuable time spent by our doctors. In fact, to tell you another truth, we had a young doctor who had just graduated, and that doctor was a student when he used to come and volunteer at the camp. And now he's a full-fledged doctor, and he spent some time with her. So when she finished going to the camp, I just casually walked over. I said, how do you feel now? She says, I don't feel sick. I feel great today. So that's a beautiful story on how our physicians treated the lady, and each and every member of our staff who was actually running the camp made sure that we followed Swami's principle of loving the person who's walking in, making sure that they leave the camp with fully satisfied and happy.
Thank you so much. That's such a sweet story. Who are we but we are just there to share the love Swami has given us, and he's the one who is healing and taking care of everything, and that's one of the most important things of this any seva activity, is getting rid of the doership. And what more than a medical camp where we can truly practice it. Thank you so much for sharing that. And that comes it's segue to what are the challenges which we may face in organizing a camp, and how do you arrange follow-ups? That was one of the questions in the chat box too. So I'm just going to segue to Dr. Kanimuri to help us with what challenges he has faced in organizing medical camps over 3 decades, and how is he planning to do like a sustainable, like a ongoing clinic, so that usually when you do a camp, you collaborate with a local general hospital, right? A local private hospital or a government hospital where you can take patients, refer patients to, you collaborate with the local emergency department. But if you want to do your own free clinic like Dr. Fanoff is doing, so Dr. Kanamori.
I'm I'm Raghu Kanamuri. I'm medical director at St. Louis for Region 4. I have been in the center for last 20 some odd years, but been attending the medical camp for last 14 years. We've been doing it every year. Over the years, we have encountered quite good feedback from the patients, and we see repeat people coming in. But the biggest problem we encountered over the years is the follow-up care. And though we have so many free clinics all over St. Louis, but none of them are really accommodative. Partly is because most of these uninsured or underprivileged people have no access to go to the free clinics, partly because of their immigration status, partly because their working conditions and no transportation. And to get into a free clinic, they may ask for social security number or some other proof of identity. Few of them could never ever go and follow up. The conditions remain the same. So we gave a thought what we should do for long term. At our cycling, we had a group meeting and we all sat together. The only solution we came up was to establish a free clinic under the name of our SSSIO Center. And we finally, over 14 years of contemplation, we took a courageous step to start a free clinic. So that is number one idea. And number two, with Swami's grace, we have a good location, good center, good place for us to start the clinic. Under the guidance of Joe Panoff, I have got little few data how to start and where to go. So the third part of it is the most important part is to get the community involved, get the service center members involved, and to have a proper structure. Once we start, it is not going to stop and we cannot be a failure. So we had several meetings in our center with fellow members, and everybody is very, very eager to help out for the community. There are good outcomes with other clinics that we have around St. Louis. We have been to the Muslim organization. We saw the service. It is just amazing. And I'm also part of St. Luke's free clinic. I've been there for last 9 years, and I do every third Saturday to take care of the uninsured. But it is backed by a big hospital. So for us to do, we need a backup plan and support. There are several organizations. The most important is Volunteers of Medicine. It is based off Washington, D.C. They will help you with establishing the clinic. And then there's also the National Medical Association for free clinics, where we can join them. They will help you with the EMR. They will help you with the guidelines. They will help you set up the protocols. And if the need arises, they will also fund you for a year or so with a very minimal amount. And you just have to pay their membership fee. And so those are the three things. But the biggest thing is the liability insurance, which is the key factor for us to function moving forward. Each state has their own guidelines, and if you apply for 501(c)(3) plan, And you can represent to the state saying that we're going to be doing this as a charity, completely charity, and we will not be charging for any reason. The state will give us malpractice insurance for a certain amount, for $1 million or $3 million, depending. So first step is to form the bylaws. Second step is to contact the lawyer who could help you out. And once you get the paperwork done, the third step is to apply for the federal permission, federal government permission to get the license and to get the benefits of serving the people. So if you have any questions or concerns, please let me know. I can help you out with the steps, what to do. But the most important thing over the years is to serve. And the only way we found the solution is to start the free clinic. And if you have any questions, you can always reach to me, and then I can help you outside out. Now, regarding setting up the clinic, it has to be in an underprivileged area or there is no access to the people. You can choose the place where you feel comfortable with and where there's absolute need for the healthcare. For that, you may have to, your local chapters have to explore, meet the community members, meet the mayor of that place to see if this is feasible. Is this place safe enough for us to do the clinic on charity so that nobody will be harmed? So that is number one factor. And two is finding the right set of volunteers. You have to have a committed people who would help you out on a long run. We can start very slow with 5 or 6 members. You need at least 2 providers, a nurse or a medical assistant, and then office staff. In the past, we used to have paper charting, and that's no longer there. Everything is the EMR, so a lot of paperwork can be eliminated. So we need a dedicated secretary or the bookkeeper to help us out with the paperwork. And depending on the volume you would like to see, we plan to start off with once a month to see how it goes. Once the volume picks up, we plan to do it twice a month. So the setup would be very minimal. It is straightforward. And we have to have partnership with local hospitals for our blood work, our x-rays, and the lab. That can be established once you have your clinic registered, and we can approach different hospitals. A lot of these big hospitals have charitable wing, and they help all the time. Number 5 is is finding the people. Once you have these, it is totally confidential. We will not reveal their immigration status. We will not tell anything. So we will strictly abide the HIPAA laws. And so I don't, if we follow the basic rules and laws, I think we should be okay to establish the clinic. All we need is the primary care who can help. Even the specialty people who've been there for a long time can also volunteer once a month or twice a month. And it is mostly like-minded people. Don't have to be from the SSSIO center. You can reach out to people. Your medical doctors can reach out to their colleagues and see if they are interested. It's just the word of mouth, and once it's established, people just come automatically. I don't think it should be a problem. But you have to have a committed number of people, and people who are coming, we have to have one personnel to check their credentials, check their licenses, and to be up to date in everything so that we will not be in trouble down the lane. Another advantage of doing medical free clinic is we can dispense medication like the regular hypertension medication, diabetes medication. But one key thing is we will not be able to provide them any narcotic or chronic pain medication. So we will be upfront and clear that we will not help them out with chronic pain medication. We can tell them the alternative ways to manage the pain, and we can refer them to pain management people. So that is another important thing that we are going to make sure when we start accepting patients. Medical camp is more screening, and we tell them, oh yeah, you have high cholesterol, oh you have blood sugars are high, you have diabetes, oh you have high blood pressure, you need to be treated. Okay, we identify the disease, but who is there in order to help them out? They have no access to see a doctor, and we cannot prescribe any medication while we are in the medical camp. So they need a follow-up, and that's our biggest advantage of starting with the patients who have been seen there. They can come here, get their medication, can be reassessed every month, and they can. That's the biggest advantage. I think all the centers should start looking into having a free clinic in their area if possible, or join a free clinic in the local community and get some more ideas and do the seva on a continuous basis rather than once a year basis.
Thank you so much, Dr. Raghu, for sharing your thoughts with us. And that segues us to Dr. Joe, as he's lovingly called in India. I've sat down in many medical camp sessions there. He's most loved there. So, Dr. Joe, would you like to take over and help us through your experience with the Ashland Free Clinic, and also what you see as a future for all us Sai Sevak Sevadals in the medical community? Thank you, Sai.
Loving Sai Rams to all of you, and I'm so happy to be here with all of you, and very inspired by everything I've seen and heard, from all the panelists. Very happy to be with you, and I'm going to talk now about the vision for the future, because what I'm going to talk about is something that we can add to our current medical camps, which I think are very good, and we can continue to do that. I think now is a good time to start doing more medical clinics, because a lot of patients we see in medical camps, they have chronic medical conditions such as diabetes, high blood pressure, and many other chronic illnesses that they need help with throughout the year. And we can do that best with a free medical clinic. And in the remaining 6, I'm hoping that by the end of 2023 next year, we can either have medical clinics going on in those regions in addition to all the free medical camps, that will have a free medical clinic in all the regions. And we have a lot of people to help support that. And I think the need of the hour, as far as one of the basic human rights, and also things the Swami talks about, people need, food, water, shelter, and medical care. And many people, especially during these trying times, need medical care. We're providing some of that at the medical camps. However, to provide ongoing medical care, it would be nice if we can do that throughout the year. And so when we're considering starting a medical camp, it could be just once a month in person. And now a lot of doctors know how to use telemedicine, I think probably almost all. And a lot of patients prefer telemedicine. So perhaps once a month, a free medical clinic in the region, and once a month, a telemedicine. And that also has the advantage of many doctors who live far away from, the place we're having the medical clinic, and they can provide that care by telemedicine anywhere in the state that you have it in. For instance, with Dr. Conner Murray's clinic, they could provide anyone that has a Missouri license can help out. So those are some things to consider. And now the next thing that I'd like to talk about is how can we proceed and plan? You know, what are the things like the building blocks that Brother Manny was talking about for medical camps? Well, first of all, there's a few things. One is that if someone has interest to do this, to coordinate things with the regional medical director, number one. Number two, with the regional service coordinator, which is even more important because they have access to a lot of enthusiastic PSI-TTs that can help. And also, we need to find at least one physician that is a SSIO, well, that's in the SSIO and is familiar with Swami's teachings on how to provide the highest quality medical care with love and devotion. And so once you have those ingredients, and then another one, which is really important, is help with the young adults. The young adults are amazing, and without the young adults, we could have not started the Ashram Free Medical Clinic. And Swami has so many young adult leaders that are like lions in the PSI organization and also outside the PSI organization. So tapping into that will be very, very helpful. And once you have that, it's almost like if you have all those ingredients and the desire to do this good work, once you get started, you're going to have a lot of people to help you. There's many people that in the United States, including myself, who have run medical clinics for some time, and we're all happy to help you. You can call us anytime. I'm personally happy and honored to be helped with any medical clinic in any region at any time. And I just want to give some guidance on the core team that you need to get started.
నిస్వార్థ సేవ వలననే మానవాళి ఏకత్వాన్ని గుర్తించడానికి వీలవుతుంది. One can recognize unity of humankind only through selfless service.